Good afternoon, everyone. Welcome to today's webinar, COVID-19, aerosol treatment devices, and ozone disinfection. The last 15 minutes of this webinar will be left for questions and answers on the presentation. And as Sam mentioned, you can submit your questions using the Q&A box. Anyone on today's webinar may receive a certificate of attendance. You will need to attend this live webinar for 60 minutes. If you did not request a certificate of attendance upon registration and would like one, please send an email to epa-webinarseries@icf.com. Just a note, EPA cannot guarantee acceptance of certificates by your organization, nor can certificates be provided for viewing the webinar recording. EPA is virtually hosting its International Decontamination Research and Development Conference, November 1st through the 5th. The call for abstracts is currently open and is seeking presentations on topics such as hazard response, infrastructure cybersecurity, COVID-19, and specifically sampling, fate, and transport, and decontamination, among other topics. More information is available on the conference website. Thank you for being with us today, and now it's my pleasure to introduce our presenters. Dr. Lucas Audians, a research physical scientist, develops and evaluates innovative technologies for the decontamination of materials contaminated with chemical or biological agents. He is currently leading research efforts to assess alternative disinfection technologies like ozone, UV light, and steam to clean surfaces contaminated with the SARS-CoV-2 virus. Dr. Catherine Ratliff, a research physical scientist, focuses on understanding and quantifying how contaminants move around in the environment and predicting the efficacy of different decontamination and disinfection practices in complex settings. And now I will turn it over to our first presenter, Dr. Lucas Audians. Thank you.
Great, thank you. Can you hear me?
Yes, we can.
Okay, great. Well, thank you, everybody. Good afternoon, good morning, good evening, wherever you are. First of all, thank you very much for your interest in our COVID-19 research. This slide actually points to the setup that we'll be talking about. There are two topics in this presentation, a ozone disinfection of surfaces part and a aerosol treatment part. So they are kind of separated, just like the two setups you see on this slide are completely different. So I want to make the distinction that there is, we're talking about two different research efforts that we will be talking about. Next slide, please. So EPA has several roles in responding to the public health emergency. And as you can see on this slide on the left, we have a response function as EPA to work on clearance guidance, technical support, and do preparedness and mitigation. EPA also has a regulatory component, most commonly related to FIFRA, and that involves pesticide registration as well as FIFRA enforcement and test method development. On the right side is actually the research that is done by the Office of Research and Development, and we do that to provide technical expertise to all these other mission areas. So some of the research that we have presented in the past was related to surface cleaning and disinfection, or pesticide devices, or residual antimicrobial coatings. And this webinar today will talk foremost about aerosol treatment later in this webinar, as well as one of the pesticide device applications. Next slide, please. So the outline of this talk is talk about the ozone surface disinfection research that we have conducted. We'll kick it off with quickly a explanation of the objectives, do a little bit of the background, or give you information about ozone itself. Then we'll have clearly our results or the setup and matrix followed by the results. We will continue then with the aerosol treatment later on, and that part of the presentation will be presented by Dr. Ratliff. And next slide, please. So the primary objective for the surface disinfection research that we have been conducting was to assess methods that could disinfect more challenging materials, such as porous materials that are more difficult to disinfect with traditional list and approved liquids, but also methods that are more applicable for large and complex areas. And when we started this project more than a year ago, we actually identified three possible approaches for surface disinfection. One was ultraviolet light, And we actually presented those results in a similar webinar that you're listening to right now on January 21st, earlier this year. For those who are interested to see the outcome of that result, they can go to the link that's provided here on this slide. Today we'll be talking about ozone as a second option for supplemental method for disinfection of surfaces. And we have research in progress related to the application of steam for the same purpose of disinfecting surfaces. We typically try to identify performance goal, and we define it as a 3-log reduction, which equals to a 99.9% viable or infected virus post-treatment. So if you hear me something saying about 3-log reduction, that means that 99.9% reduction. Next slide, please. So a little bit of background about ozone. First of all, many of you probably know that it's a strong oxidant. And with that comes that it has a health risk because it will damage the respiratory system if it is above a high concentration. A couple of numbers to keep in mind here is that there is an IDLH value of 5 ppm. And then there are actually NIOSH recommended exposure level limits, RELs, for ozone that is 0.1 ppm. One thing to point out here is that ozone actually may be a friend in our stratosphere, where it protects the UV from coming to Earth, or at least the harmful parts of the UV, more harmful part. But here it is in the air we breathe, it is a pollutant. Next slide, please. So a little bit of a background of ozone as a disinfectant. If you go look up the literature about ozone, you will find that it has recognizable antimicrobial or antiviral properties. Most of those studies actually have been conducted where ozone was actually in water. What we found out was that when we started this project related to SARS-CoV-2, there was a limited number of studies that actually looked for ozone as an approach for disinfecting surfaces, or for that matter, even aerosols. So what we set out was to do is actually find to establish or collect more information related to ozone, but also keeping in mind that we want to get under more realistic field scenarios conditions. So we introducing various materials. We're not working only with a petri dish with the virus resides in, but we want to include various materials. We wanted to focus on maybe different inoculum types, whether it is in a standard tissue culture media, or whether it is in a simulated saliva environment, which is more realistic to what will be encountered in a field setting. We also probably want to make sure that the exposure conditions are more realistic. Last thing to point out is that if you look in the literature, you will find a large variability in any inactivation rates related to ozone, and for that matter with other technologies. And one of the main reasons behind this, unfortunately, that there is so much differences in test conditions. So that is why it's difficult sometimes to compare results side by side. Next slide, please. So our ozone setup and generation was relatively straightforward. We are working in a biosafety level BSL-3 facility because we're working with the SARS-CoV-2 virus itself. That's illustrated on the left side. In the middle, you see a close-up of the rack that held actually the coupons, the 3 materials that we selected. We'll talk about it in a moment. We selected a standard ozone generator that is used and can be found and purchased relatively quickly. The thing to point out is that those units are actually sold also for indeed ozone applications in small rooms or hotel rooms. So it is something that is suitable for this size of chamber. Next slide, please. So our ozone test matrix was relatively straightforward. We did our research at 10 parts per million of ozone concentration. We have one test conducted at 20 parts per million by volume. The relative humidity was something we tried to control. We have essentially identified a high or a low concentration, low humidity of 50% and a high humidity of 70 to 80%. That's kind of our working range. We looked at 2 contact times, 30 minutes, or actually 3 contact times, 15, 30, and 60 minutes. The materials that we were working with were actually selected based on their presence in transportation hubs, in metro cars or in buses, So they were selected for that purpose: stainless steel, ABS plastic, but also a bus seat fabric. Our inoculation application consisted of the application of 10 droplets of 10 microliters in volume, and the SARS-CoV-2 virus would either reside in a tissue culture media with 5% FBS, or a simulated saliva according to an ASTM method. Last thing to point out is that we actually looked at data when we started the ozone fumigation in the presence of wet droplets. So immediately after inoculation, the ozone fumigation started. But we also looked at what happens if the droplet is allowed to dry first before we start the ozone fumigation. That latter scenario with the dry droplets is something that's far more realistic, recognizing that the chance that there are wet droplets present when you start an ozone fumigation, which requires time to set up, is rather unlikely. Next slide, please. So quickly, a little bit about how we did the virus recovery. Each coupon was aseptically retrieved, was placed in a conical tube, vortexed. We actually split our samples. We did our standard tissue culture media, tissue culture analysis, but we also set aside a subset for rapid viability PCR. And that's why that work is actually still in progress. We then cultured the one part of that sample, and we ended up with testing it for viable virus using the TCID50 assay. One thing I want to point out is that we will be talking about log reduction, and when we talk about log reduction, it means that we actually took the log reduction based on the recoveries from the positive controls that were time stamped with the same amount of time that the coupons with the virus were in the chamber without the presence of ozone, minus the recovery from those in the presence of ozone, known as test coupons. Next slide, please. We did a little bit of additional method development prior to the actual test. We, for example, verified that we were capable actually to recover high enough recoveries of SARS-CoV-2 virus from these surfaces. We were typically able to get in the 10 to the 5th PFUs, phase forming units from a coupon, which then allows you to indeed demonstrate a possible 3-log reduction. We also demonstrated that there was no cytotoxicity for these 3 materials. And we also established that based on the selected procedure for analysis, we identified the detection limit of 6 virons per coupons. Next slide, please. So this is the first slide of with the results. So on the left, you see the data that came out of the first test. And to guide you a little bit through this test, to the data on the left side, on the vertical axis, you actually have the log reduction that I just defined. On the horizontal axis, you see three groups for each material. Start over again. You will see 3 materials: the bus seat fabric, the ABS plastic results, and the stainless steel results. And you see that for the tissue culture media and for the simulated saliva. The vertical bars are showing the log reduction as function of the time that the SARS-CoV-2 virus was exposed to ozone for different time periods. It started with 15 minutes as the lowest, then another 30 minutes, then a repeat actually for a 30 minutes, and then a 60 minutes experiment. So those 4 data points are visible in the colorations from light blue to darker blue. And the general trend can be seen that the longer you wait or the longer the exposure time is, the higher the efficacy is. So that is encouraging. Just to point out, we have indeed verified that the positive controls had high enough recoveries to make these log reductions visible. We clearly see indeed that ozone can inactivate the SARS-CoV-2 virus, and we see in some cases close to a 3-log reduction. In one case, for a stainless steel in the simulated saliva, actually were able to achieve a full inactivation of virus, as there was nothing remaining on the surface after a full hour of 10 ppm ozone for this wet droplet. Next slide, please. Unfortunately, the situation is a little bit different for a condition where we have dry droplets at the start of the ozone fumigation. Here we find much lower log reduction. Again, the horizontal axis shows the different materials, depending on which media we're using, tissue culture media or the simulated saliva. In this case, for these dry droplets, we did not see more than a 1 log reduction. And we did not see any time dependence either, which was a little bit surprising. So this has brought us to think about what else is going on here. It appears that the lack of water may be a reason why we do not get through a high inactivation of the virus itself. Next slide, please. So this is actually that side-by-side comparison just to illustrate how different the results are. On the left side, you see the results for what we obtained for the wet droplets. While we see on the right side, you see the log reductions for the dry droplets, and there are distinct differences between the two data sets. Next slide, please. So we also conducted research at the lower RH, just to see if that made a significant impact. And in this case, actually, we found that we were able to, again, get at a 3 log or even higher reduction. Again, on this slide, vertical axis is the log reduction, and on the horizontal axis are the groups of 3 materials and the various medias, but also the wet droplets on the left side, and on the right side, more the dry droplets data. So again, we see that we see a significant difference between whether we were inactivating a wet droplet with ozone versus a dry droplet. We also noticed, and that's actually something I could have mentioned earlier, is that we do not see too much of a material dependence in the efficacy. So it is equally able, you can disinfect the SARS-CoV-2 virus on these 3 materials almost equally. I pointed out earlier that we also did tests with 20 parts per million of ozone. Unfortunately, we had a little bit difficulty in the amount of recoveries from our positive controls. And therefore, we probably just have to revisit that 20 parts per million test point, because it did not align exactly with what you see on the screen here. So we will be verifying that again and then making further assessment. And next slide, please. So this is kind of the wrap-up for the ozone disinfection part of this webinar. Clearly, we are able to see an inactivation of the SARS-CoV-2 virus on various surfaces through ozone fumigation. We did see that a 2 to 3 log reduction can be achieved, which equals to a 99 to 99.9% reduction on the surface when you would expose it to ozone at 10 parts per million for a full hour. What we did see is actually that the virus is actually far much more difficult to inactivate when it is visible in present in a dried droplet versus a wet droplet. As I said, the water content may actually has to do something with a diminishing effect on the ability to inactivate the virus. We did not see really a significant difference between the 50% versus 70 to 80% inactivations for the dry droplets. And the last thing to point out was that the wet droplets data actually is consistent with what we have found in the literature. So that's something to point out, and that's good to know. I think we are moving on to the next slide. And that slide is a perfect transition to let Dr. Ratliff take over it from here to talk about the aerosol treatment research. So Catherine, take it away.
Thank you, Dr. Odions. Can you hear me okay?
Yes, I can.
Great. Thank you, everybody. So as Dr. Odions mentioned, we'll be switching gears and talking about aerosol treatment technologies now. So similar to the ozone portion, I'll give some background and a little bit of a description on our methods, and then discuss some results from 3 different types of air treatment technologies. Next slide, please. So I don't think I need to spend too much time motivating why we are interested in understanding technologies that may be able to reduce aerosol transmission of COVID-19. It continues to be an important issue that a lot of research is focused on today. So with that increased focus on airborne transmission of COVID-19, there's also increasing interest on different types of technologies that claim to be able to reduce the amount of airborne virus and therefore reduce the risk of airborne transmission of COVID-19. Many of these technologies are actually pesticide devices, which are not registered by EPA. Pesticide products are registered by EPA, but pesticide devices are regulated under FIFRA. However, there's no registration process, so EPA does not routinely review efficacy or safety data of these devices. So with thinking about these different types of air treatment technologies, there's a number of challenges. There's obviously a growing desire to come back to populated indoor spaces. We all want to get in different situations where we could be in contact with other people for extended periods of time, but that obviously leads to increased transmission of COVID-19. Obviously, social distancing is not always feasible in certain locations, such as in public transit or different types of events and gatherings and in schools. And a lot of these air treatment technologies have testing data, but it's often not independent testing data to verify the claims that manufacturers are making. Next slide, please. So the goal of this research is to evaluate how these different types of commercially available air treatment technologies are effective in reducing the amount of airborne virus. And so a number of goals under that are to, again, assess the efficacy, understand how effective these technologies are in reducing airborne virus, and in doing that at a scale that is representative of real world conditions. So a lot of the testing that's often done in the lab is done in a really small scale. You saw some pictures of what our ozone setup looked like for testing with SARS-CoV-2. It's done in a relatively small box. However, those types of results can be hard to extrapolate to thinking about things like a classroom or an office building. We also want to understand what types of methods can be standardized. And so we're able to compare across these different technology types to understand how effective one technology type it might be or versus another, because oftentimes the testing is done in very different ways that makes it hard to understand how the various efficacies relate to one another. And we also want to understand how to really understand how to extrapolate what we find in the lab to different types of technologies, because there's, as I'm sure many of you are well aware, there's an increasing number of technologies on the market, not only vendors of particular technologies, but technology types. And so we need to get a handle on understanding the efficacy of these various technology types. Next slide, please. And so some of the technology types that we've been focused on, this is not a completely exhaustive list, but some of the things that we've been thinking about in particular are UVC devices. So UVC can be used either in duct or, for example, in upper room germicidal UV. There's also different types of chemical products and devices. So devices that emit, say, for example, low concentration ozone or hydrogen peroxide, or different types of bipolar ionization devices. There's also technologies that physically remove particles and therefore virus from the air. So these are things like specialized filters or portable air cleaners. And there's also a number of different devices on the market that utilize various combinations of the above types of technologies. So one important thing to mention is that while this research effort is focused on different types of air treatment technologies that can be used in or have been proposed for use in occupied spaces, whether that's in room or in duct, we are focusing on evaluating the efficacy of these devices in this study. So how effective they are against airborne viruses. We are not evaluating public health impacts from these various technologies, devices, and products. That's something that is of interest in ongoing research, and we recognize it's really important, and we're monitoring for some various different byproducts emitted by some of these technologies. However, I want to emphasize that's not necessarily a focus of this study, but certainly is something that should be kept in mind when deciding whether you're interested in implementing these different types of technologies. Next slide, please. So we are conducting these efficacy evaluations against MS2, which is a non-pathogenic virus. It's expected to be more resistant to disinfection than SARS-CoV-2. Next slide. And this chart gives you a snapshot of a number of different items related to various viruses that we've used in our EPA Office of Research and Development SARS-CoV-2 research with MS2 on the left and SARS-CoV-2 all the way on the right. So MS2 is actually a bacteriophage, which means it infects bacteria and not humans, therefore it's non-pathogenic. It's a biosafety level 1 organism, so it's much safer to work with than SARS-CoV-2, which is BSL-3, and it ranks higher on the Spalding hierarchy of microbial resistance. So therefore, again, we expect it to be more difficult to inactivate than SARS-CoV-2. Next slide, please. So we are aerosolizing MS2. We are doing that using Collison nebulizers. The median droplet diameter of the particles that we are aerosolizing at the beginning of a test, right after the particles are aerosolized, is about 45 nanometers, and that grows over the period of the test to be about 100 nanometers at the end of a test, 90 or 100 nanometers. So this droplet size is quite small. It is within the range of droplet sizes, or I should say aerosol sizes or particle sizes that are emitted from humans, but we're not necessarily designing these tests based on a droplet size distribution that is characteristic of what's emitted by people, because there's such a wide variability in that. So just keep in mind that this is a relatively small aerosol particle size. We are sampling the air using SKC biosamplers, and we take those biosamplers and we actually enumerate the how much, we use a plaque assay to enumerate or count how much viable MS2 is captured by each of these biosamplers over time. And we also have some real-time bioaerosol sampling data. We are also looking at some surface sampling. So although the focus of this research effort is really on aerosol, evaluating aerosol efficacy against aerosols, we are taking advantage of the test setup and are looking at two different things. We have included small pieces of stainless steel, again, we'll call them coupons, 2 by 4 centimeters, in the test chamber. Some of them are inoculated, so have the MS2 virus put on them. And then we also include some of these coupons that are clean, so they have no virus on them at the start of a test. And in looking at those coupons, we're interested in understanding how much viable virus is actually deposited on surfaces throughout the test. So for the tests where we've included those 2 types of coupons, there are 5 pairs of them co-located on the chamber floor throughout the test chamber. We also are conducting all of our microbiology on site. We have a microbiology lab that's doing all the processing in the afternoon after we run the tests in the morning. And we are also measuring for particle count and size distribution throughout testing using a scanning mobility particle sizer. Next slide, please. So we're able to utilize a really specialized test chamber in Research Triangle Park. This is a 3,000 cubic foot large test chamber. Could be, a little bit bigger or smaller than a bus, depending on the bus that you're on, but just to give some scale there. We are controlling the temperature and humidity throughout tests. The temperature is a pretty much room temperature, and then the relative humidity is around 30 or 35% RH. This is on the lower end of the recommended indoor range of relative humidities, but within it. And we are testing on the lower end because MS2 viability is actually reduced at a higher, or around 50% or intermediate relative humidity. And at that relative humidity there, we tend to get more agglomeration or settling of MS2 as well. And because we want to keep a lot of MS2 in the air, we are testing at this lower RH. And along those lines, we're also using mixing fans to keep the virus suspended. Next slide. So we have also constructed a mock HVAC system inside the test chamber to simulate recirculating air. We have a negative air machine that simulates a mock cold air return, and we're able to adjust the flow within that machine. So the test that you're seeing the results for today, they were conducted with a flow through that negative air machine at about 350 CFM. So this leads to about 7 air changes per hour through that NAM. The HVAC is constructed out of galvanized steel duct materials, and there are 6 different diffusers in the test chamber and that main line that help to recirculate the air. Next slide, please. So these are just a couple pictures from inside the chamber to give you a sense of scale about how big the chamber is during testing. Next slide. So the just to hit again on the testing objective here, we designed this test to be able to obtain a high recovery of MS2 or aerosolized virus throughout a 90 or 120-minute test period. We also designed the test to be relatively challenging. So again, using MS2, which is a relatively hardy bacteriophage or virus. We also, again, have picked temperature and humidity controls in particular, and using mixing fans to try to keep that virus lofted. With all of that being in mind, because we want to be able to have a really high, or be able to demonstrate a really high dynamic range with technologies that are effective. So again, going back to that goal of being able to demonstrate a 3-log reduction where possible for these various technologies. So essentially you have to have enough virus still in the air at the end of a 90 or 120-minute test to be able to have the technologies be able to demonstrate that dynamic range. Something else to keep in mind is that this is still a lab setup. So there are, even though it's a large scale lab setup and we have this recirculating HVAC, there are a number of considerations that need to be taken into account when thinking about extrapolating results into the real world. So obviously things like the HVAC system setups probably very different, or is very different than many settings. Again, things like temperature and RH can vary and impact efficacy of these various technologies. Next slide, please. So this chart here shows you the different technology types that we are evaluating in this current research effort. We used stakeholder input, so offices within EPA, as well as large transit agencies, to help hone this list of technology types to be evaluated. So they include a bipolar ionization device, Grignard Pure, which is a pesticide product. It's the only pesticide product on the list of technologies that we evaluated. We also chose to evaluate one of those combination devices, the Knorr 3-stage air filtration and purification system, which has 3 different components or modules that are aimed at reducing airborne viruses. We also have a photocatalytic device that we are evaluating, and we're evaluating different types of filters as well. So next slide, please. So today we are going to be talking about 3 sets of results. The first 3 noted here. We have testing with photocatalytic device and different filter types ongoing this month and probably into next month as well. Next slide. So first set of results to talk about are from the bipolar ionization device. Bipolar ionization generates ions that can react with different types of airborne contaminants, including viruses. The device that we selected to evaluate was sized to treat what was not necessarily designed to treat the size of the test chamber, but is sized to treat a space that is comparable to or larger than the test chamber. We installed it in duct, so in the location on the right-hand side of in the picture. And we also ran the device for between 30 and 90 minutes before starting our aerosolization of MS2, which allowed the ions to build up in the chamber, and therefore we're essentially introducing the aerosolized virus into air that is already treated by the air treatment technology. Next slide, please. So here are the first set of results. On the x-axis or on the bottom axis, we're showing sampling time. So the samples recovered throughout the test time between 90 and 100 minutes for this technology. And on the y-axis here is the amount of MS2 recovered from the duplicate biosamples or the air samples. And for this graph, the control, so the control again, meaning tests where the technology was not active, the controls are represented by the dashed lines, and the treatment tests are represented in the solid lines. And you'll note that for all of these technologies, we run multiple replicates of our tests, and that's to account for the natural variability that is inherent in working with microorganisms, especially when you're aerosolizing microorganisms. So we want to make sure that we're running enough tests to be able to account for that natural variability. And the first thing to note is that there is some natural decay and settling in the control tests. You see those lines go down over time, even without any type of treatment technology. And again, we want to account for that natural decay in our and settling in our efficacy calculations. So just as in the ozone portion of the talk, we are similarly looking at time-matched controls. And on the next slide, please, will be, yep, next slide. So the log reductions that we calculate are actually an average of the sets of tests versus control conditions and subtracting the recoveries of the average recoveries of the controls at each time point minus the average of the test recoveries. So these bars, the gray bars represent the controls, the average of the controls at each time point, and the blue represents the test average of the test time point recoveries for MS2. And the calculated log reduction is denoted by the orange line here. So the range of log reductions that we saw over the span of the testing time points goes from actually negative log recoveries up to just under 1, about 0.85 log reductions during the test period. And a couple of things to note for this particular technology is that we didn't see any additional virus deposited on surfaces with the deposition coupons, and we also didn't see any surface inactivation from the coupons that were inoculated and included in the test chamber. So, and another thing to note too is that for all of these charts, we have error bars that show those standard deviations. So just again, keep in mind that natural variability, and a lot of these bars are showing that although there are some slight differences in looking at log reductions, there's definitely some variability to keep in mind in looking at these results. Next slide, please. So the next set of results to talk about are from Grignard Pure. It's that air treatment product. It currently has a Section 18 emergency use exemption for a number of different states. It has triethylene glycol as its active ingredient, and this particular ingredient has been used historically for different types of theatrical haze or fog or smoke, so like for Broadway shows or for concerts. However, there are publications using this particular ingredient for air treatment or disinfection dating back to the 1940s. And we did measure airborne, or the concentration of the triethylene glycol, the active ingredient, in the air during testing using a NIOSH method, and found that it was between about 1.2 and 1.5 milligrams per cubic meter. And although there's no exposure threshold limit for triethylene glycol in particular, this is within the American Conference of Governmental Industrial Hygienists short-term exposure limit for ethylene glycol, and it's also within the approved concentration levels for the Section 18 emergency use exemptions. And for this particular product, we were interested in looking at two different types of test sequences: introducing the product into the chamber where MS2 is already aerosolized, and that particular test setup is of note or of interest because it's the highest amount of MS2 in the air, so therefore the greatest challenge for the product. And we were also interested in looking at introducing MS2 into the chamber with the target concentration of the product already present. And that is more representative potentially of, say, an infected person walking into a space with treated air. Next slide, please. So similar graph with lots of lines here, but essentially it's the same setup as the previous set of results. The controls are shown here in the gray lines, and the test where the Grignard Pure product was introduced into MS2 after that time equals 0 sample was taken are shown in the warmer colors, and the test where the MS2 was introduced into the product. So the product was at concentration in the chamber before the product was in the chamber before MS2 was aerosolized. This is noted in the cooler colors here. Next slide, please. So again, these two bar charts are summarizing or averaging over all those lines you saw in the previous two graphs where the controls are in for each time point. The average of the controls are in gray, and the yellow and the green bars represent the average recoveries from the tests where the product was introduced into MS2, or the MS2 was introduced into the chamber with the product already present, respectively. And we can look at the log reductions, calculated log reductions ranging from about 1 to about 2.3 for the data on the left where the product was introduced into MS2. And looking on the right, from about 1.5 to over 3 log reduction, looking at MS2 introduced into the treated air into the product. Next slide, please. So the graph on the right just summarizes what we saw on the previous slide, where we have the log reductions for the two different test conditions side by side. But essentially the takeaway here is that there's a higher calculated efficacy when the MS2 is aerosolized into the treated air when the product is already present into the chamber. A couple other things of note, looking at the bottom right-hand figure, we did also include the two different coupon types to look at the inoculated coupons. We did see a reduction in the amount of MS2 recovered from them after the test. That was about 1.5 log reduction for the product introduced into the MS2, so with the higher MS2 concentration in the beginning, and closer to an average log reduction of 2 for when the virus was introduced into the treated air. And we also saw denoted in the blue bars here that the MS2 recovered from the deposition coupon. So how much MS2 was found on the surfaces after the completion of testing was lower as well with the product present in the chamber. Next slide, please. So moving on to the 3-stage air filtration and purification system. This is a system that was developed by the Kenora Brake Company for various types of transit vehicles. It contains 3 different components: an electrostatic filter, what I'll be calling the MIFD component, a bipolar ionization component, which will be denoted by MDBD for the result slides, and then also a UVC component. So this is a UVC light in the device or in the unit as well. And this test unit contained the capability to let you turn on and off these different components individually. And so you'll see that we tested various combinations of the different components. So the picture on the right shows the unit actually in the test chamber. The unit also has a fan or a blower. It's from a subway car HVAC system itself. So this blower runs at about 1300 or 1350 CFM, which leads to about 25 air changes per hour of treated air through the device in the chamber as well. And we ran this with the recirculating HVAC still operating, which on its own leads to about 7 air changes per hour. So it's definitely a different setup than the prior 2 tests. And we also ran controls with and without the MIFD, or that electrostatic arrest filter. So the MIFD component contains an actual physical filter that then gets charged when that component is powered, but we can actually remove the physical filter and test it without power and also removed. So there is still, you'll see some filtration that occurs from this particular component even when it's not powered. Next slide, please. So it would be a lot of lines to put every test up here, but essentially these are the lines that summarize the average of the test replicates for the various combinations that we tested. As I mentioned, the 2 dashed lines are the controls, where we have 2 different sets of controls: the control with the electrostatic arrest filter in place but not powered, and then the control without that filter there, period. So just removing that filter altogether. And then you'll see from the legend, we've tested various components, the electrostatic filter, the bipolar component, and the UV on and off. And we have 3 replicates of all of these runs except for the bipolar and UV component that was run with just 2 replicates. And then the bipolar component by itself was run with just 1 replicate. So really the takeaway here is that there's not a huge difference in terms of efficacy when we're looking at these various components, except for the 1 test, maybe where the bipolar component was on by itself. But again, that just was a single replicate, so we have to take that with a grain of salt. Next slide, please. So these 2 graphs show, again, the averages of the log recoveries for using the 2 different controls. So the control where we're looking at the filter for the MIFD component being in place and the control without the filter being in place on the right. The calculated efficacy for each of these time periods and technology combinations can vary by even greater than 1 log depending on the control condition. So next slide, please. So So another thing that's interesting to look at for these particular set of tests is that the actual amount of particle capture. So we mentioned that we were looking at the particle size and count throughout testing. So this graph on the right shows, again, the sample time on the x-axis and the actual particle concentration on the y-axis. And you'll note that the particle capture is actually quite a bit higher. So there's fewer particles in the air for all of the tests where the electrostatic filter was powered. Another thing to note is that the controls without the filter in place are in the blue dashed lines, and the controls with the filter in place are the gray dashed lines. So you'll note that just putting that physical filter in place, even though it's not expected to have a really high MERV rating, it does remove a good chunk of particles even when it's not powered. Another interesting thing to note here is that when the MDBD, the bipolar, and the UV components are looked at on their own without the electrostatic filter on, we do see a difference in terms of the amount of particles in the air. There's more particles in the air without that electrostatic filter on. However, we didn't see that big difference in the efficacy values. So that leads us to think that the bipolar and the UV components for this particular device do contribute to the MS2 inactivation, because we do see those comparable efficacy comparisons. Next slide, please. So to summarize all of this, we find that we can look at evaluating these different types of air treatment technologies using relatively similar test methodologies. Again, these are quite different technology types, and granted that the Knorr blower operating at a much higher rate than the other two leads to some differences in the testing, but we're able to effectively evaluate them all in the same chamber and look at ranges of efficacy from less than 1 log reduction to greater than log reduction, depending on the technology type and how the test is designed. We also find that testing at a real world scale, at a large scale, is really important to be able to understand how these technologies would operate in the real world. So again, we can't stick a technology in a small box and look at those results and be able to reliably understand or predict how it would be, how effective it would be operating in the real world. And there's also a number of other factors that need to be considered when looking at extrapolating data from any sort of lab test, including temperature humidity, and again, like the HVAC design, as well as how quickly the air is turning over, the amount of fresh air introduction, things like that need to be considered. And then another important thing I want to have as a take-home message is that the design of what your control conditions look like can greatly impact the calculated efficacy. So again, we design our tests so that we're accounting for that natural decay and settling of viruses using those time-matched controls, which allow us to really hone in on the technology efficacy rather than being over or underinflated based on those control conditions. So as some next steps, we're continuing to evaluate the photocatalytic devices and some filters over the next month or two. And next slide, please. We'll get back to where you can find out data about those upcoming tests. But first, some acknowledgements. We want to thank for both of these projects a number of EPA folks and large project teams. We've worked closely with a number of EPA program offices and regional offices, as well as our health and safety. We've worked closely with New York City Metropolitan Transportation Authority and LA Metro, and value their input in this research. And we'd like to thank both Battelle and Jacobs Technology Group for supporting the lab tests shown, the results shown here for both the ozone and air treatment studies. Next slide, please. So here are our points of contact, our email addresses. Please feel free to reach out. And then I'd encourage you to take a look, if you haven't already, at our COVID-19 research webpage. That's the link is shown on the right here. We are posting interim website updates with data as we get test results in. So if you want to take a look at that down the road in the next couple of months, there'll be additional data posted from the presentation today, as well as a number of other research projects related to COVID-19 going on within the Office of Research and Development. And with that, we really thank you so much for taking the time to listen in today, and I think we're happy to take some questions.
Yes, great. Thank you, Catherine. Thank you, Lucas. Catherine, we're going to give you a little break, and I'm going to send some questions to Lucas. So the first question that came in, could you explain a little bit more about what a coupon and inoculum is?
Good questions, thank you. Coupon is actually a piece of material representative for the larger material. So a small piece of material like stainless steel or ABS plastic or the plastic fabric. Inoculum is essentially the liquid in which the virus resides, and it is used to apply the virus onto the surface in small droplets.
Great, thank you, Lucas. Also, can you talk a little bit regarding dried materials? Is the virus infective in dry materials?
Well, what we saw was that it is difficult to inactivate the virus when the droplets are dried. And by dried, we mean that we purposely allowed the droplet that was initially a liquid to dry on the surface first, and then we would expose it to the ozone fumigation condition. And we did see that it was more difficult to inactivate the virus in that condition versus a direct comparison with a wet droplet.
Right. The next question is, why is the 3 log reduction a hurdle highlighted in particular?
It's part of the definition of what is called disinfection for viruses, according to the EPA. That is a different number. That 99.9% reduction is different than from what you may find as the disinfection definition for bacteria. So I wanted to point out as well, this applies for viruses.
Great, thank you, Lucas. Okay, a few questions for Catherine as well. So the first question is, if you have a routine air handling system in a space, how can the droplets stay so long in one?
So that's definitely to be a function of the droplet size, as well as things like the humidity of the space. So and also the people who are occupying the space and what types of droplets they or aerosol particles they are emitting themselves. So it really is dependent on the particular conditions within that space to understand how particles could be remain lofted for that extended period of time.
Great, thank you. Another question is there any interest to expand capabilities for testing and disinfection beyond viruses indoor, considering there are other indoor allergens pre and post COVID-19 that will continue to persist as consumers look to reoccupy various indoor habitats?
Yes, there is definitely interest in conducting that research. We, within the Homeland Security Research Program at EPA, have done a lot of work on spore-forming bacteria. So with surrogates for Bacillus anthracis or Bacillus anthracis itself, although not in our facilities. And that's one of the reasons why we're using MS2 for the aerosol treatment work. Because it is hardier than SARS-CoV-2, we expect that the efficacy data generated against MS2 would be more broadly applicable to different types of pathogens. But again, it all comes down to the hierarchy of disinfection and understanding how hardy a potential surrogate organism is relative to the pathogen of interest. But so that was a long answer for yes, it's definitely something we're interested in looking at.
Thanks, Catherine. Another question before we go back to Lucas. The testing for BPI, I'm assuming that's bipolar ionization, looks to have been completed in environments with upwards of 7 air changes per hour and 30% relative humidity. Can the test results be applied to spaces with the lower air change rates and humidity?
So again, there's a number of things that need to be taken into account to be able to extrapolate the device results from the lab into the real world. The first being the device type itself. So there's many different types of ionizers on the market that produce different ion concentration levels. And so in addition to the temperature, or the humidity, and the air change rate, there's a number of other things that need to be considered in terms of extrapolating the results from the lab to the field. However, these results are helpful in terms of understanding how effective these technologies would be in a relative sense. So, we did again see at some time points some efficacy from that technology, and we can compare it again against the different technology types. So just to keep in mind, there's so many factors that need to be taken into account. And this type of lab study is really a first step in understanding how the efficacy of these technologies is at a large scale. And then there's additional steps that need to be taken to really understand how that would fit in the real world. Yep.
Thank you, Catherine. Lucas, how do you control and measure ozone levels in water you generated from the ozone generator?
So I think that may be a little bit of confusion here. We did not generate the ozone in water. We actually are fumigating the ozone in the air and exposing the coupons to the ozone in the air. So there was not water involved in that regard.
Thank you, Lucas. Back to Catherine. Are you assuming all air is recirculated, or is there fresh air being used as the standard?
So for the tests that we conducted, there is no fresh air introduction. Again, that is part of the emphasis on creating the most challenging test environment we could for these particular technology types. That's another thing to take into consideration when you are trying to extrapolate how these results might translate to the real world, are things like fresh air introduction. So that's a great thing to keep in mind.
Thanks, Catherine. Another question. Why choose MS2 for chamber studies, which is a phage instead of MHV? Are there plans to expand into other domains?
It's a great question. So MS2 is a BSL-1 organism. When we aerosolize different types of microbes, we typically treat them at a BSL level higher than they are. So essentially we're treating these tests as a BSL-2 type lab condition, and with all the necessary precautions for a BSL-2 lab setup. MHV is a mammalian virus. So as we go up in BSL levels, and we're continuing to increase the BSL level to account for that aerosolization, quickly we get into, with mammalian viruses, BSL-3 containment environments. And so those type of containment environments are what we are conducting the SARS-CoV-2 testing in. So if you recall that the chambers that were shown, or picture of the chamber that was shown for the ozone study was much smaller than the size of the test chamber for the air treatment study. It's because there's a lot more health and safety precautions and biocontainment precautions that need to be taken into account for those higher BSL-3 conditions, whether it's the organism itself on the surface is BSL-3 or it's a BSL-2 organism that is aerosolized. So that's a long-winded way of saying we definitely would be interested in conducting the research, but we, for this particular effort, we're interested in conducting the research at a large scale. And so that necessitates using non-pathogenic viruses for this particular type of test. So things like MS2 or phages.
Thanks, Catherine. We're at the 2 o'clock hour, so I'm just going to ask one last question regarding the aerosol devices. If your question was not answered, please feel free to send an email to one of our researchers or to the Caesar or ORD email address, and we will try to get you an answer. So the last question is, how is the MS virus introduced into the test chamber? Is it continuous or bolus? Also, did you continuously release the bioaerosol during the test, as you would expect if the space was occupied during the time by an infected person?
Yeah, great question. So we aerosolized over a period of just 10 minutes at the beginning of the test, and then didn't continue to aerosolize throughout the test. So that condition where there's continuous release would be something that is certainly we'd be interested in looking at. However, for these tests, we just aerosolized for 10 minutes, and then there was no more bioaerosol introduced throughout the rest of testing.
Great, thank you so much, Catherine. And with that, we conclude today's webinar. Thank you all so much for attending. We'll see you next time.